In tonight's Health Matters, hurry up and wait. That's what usually happens when you arrive at the emergency room at any hospital in America. The waiting game for emergency care is in critical condition itself. But we are learning not all are true emergencies, and it is clogging up the system and costing millions of dollars. Fox 13 anchor Daryl Green spoke with one expert about how some patients are abusing the ER system. But first, we sent Fox 13's Lauren Johnson where cameras usually cannot go, inside the ER. Lauren?
Hey there, Merle. You're right. We asked for access inside all emergency rooms in Memphis in the Mid-South, and most hospitals agreed and were accommodating, like Baptist Memphis, where we are now. You can see the emergency room there over my shoulder. They let us inside to see what processes they had in place to speed up the wait time inside emergency rooms. Well, some hospitals are working on tactics outside to keep consumers close, making sure they don't miss out on millions.
The busiest day of the week is usually on a Monday.
2 words, emergency room. They can save your life, but they can also drive you mad.
It's pretty ridiculous.
Across the country in 2009, patients spent 110 million hours waiting.
We're an emergency department. We're not a doctor's office. You don't call, you don't make appointments.
Or do you? Fox 13 learned you can skip to the front of the line for a price.
The patients really like the system because they're able to register online, and they're actually assigned an appointment time to come in.
An appointment in the emergency department sounds like an oxymoron, but at St. Francis Hospital in Memphis, you can now log on, pay a fee of $15, and be seen within 15 minutes of your arrival, or get your money back. Hospital administrators say they don't see a dime of the money. It goes to fund the reservation system, which is called In Quicker. Trish Higgins, the director of the emergency department, says this is not only a huge time saver for patients, but also helps the hospital.
To be able to anticipate what patients are going to come into the emergency room makes it much easier for us to look at our staffing patterns to make sure that we have enough staff to handle the patient load. If you're really not feeling well at all, it's much easier to wait at home so that you know when you have your appointment time, you can just come in.
On average, at St. Francis, 1 in every 4 people who visit the emergency department don't require emergency care. This only adds minutes, even hours to the process that already has patients waiting up to 4 hours at some area hospitals. The new system helps doctors better assess who needs what and how quickly. Triage via the World Wide Web.
We've seen someone who may have fallen and hurt their wrist. We've also seen people coming in with sore throats, people that have had toothaches. It's really those non-emergent types of cases.
Methodist University Hospital has tuned into technology, too.
Many surveys that are out there around the country say that one of the most important things that patients really want to know is if there is a wait, they just want to be kept informed.
David Cummings, corporate administrator of patient care operations, says the wait times went on the web back in August. Updated every 2 minutes, the estimates are from the moment a patient walks into the door until they are seen by a medical staff member.
Our goal is to see every patient in 30 minutes. We certainly strive to do that each and every time. Matter of fact, we have guarantees at several of our hospitals to see patients within 30 minutes.
The patients with life-threatening illnesses will continue to receive priority in the emergency room, but logging on will help people decide which hospital will best meet their needs at that time.
And the hospital recognizes they're coming anyway, so we might as well do what we can do to expedite those people through the system.
Joe Holly, medical director of the City of Memphis's Emergency Medical Services, thinks all the systems should go beyond spreading the load.
That's okay. I think there would be great advantage in expanding that system to say, well, based on your complaint, your problem, we can schedule that appointment for you in the doctor's office. You don't need to come to the emergency department for that.
In fact, research done at the University of Memphis shows $121 million is spent annually in Shelby County hospitals for non-urgent emergency room care. Care that would not have happened if primary care had been properly delivered in a doctor's office.
It's just not a great place to provide quality, continuous, ongoing care and management of chronic medical problems.
Hospital administrators say one way to lighten the load inside emergency departments is for people with non-emergencies to use urgent care facilities and clinics like this one. Why'd you decide to come here?
I think I have an ear infection.
Jennifer Podesta works at the Kroger pharmacy, and her trip for care was just a few footsteps away. How long was your visit to the doctor?
Just a few minutes. It was really easy.
The Little Clinic provides care without an appointment, and wait times are usually drastically shorter than emergency departments. They first opened 10 years ago as an alternative to urgent care facilities and emergency rooms.
I mean, it is a lot faster. You just come in, they tell you what's wrong, you get your prescription, walk over to Kroger pharmacy, and get it filled. So it's really quick.
And while quick is the goal, only public education can affect change in the system. Hospitals are making it easier for people to continue to treat emergency departments as doctors' offices, making appointments and checking your wait time.
The old days of people just showing up to the emergency department, signing in, waiting for a bed are pretty much over.
In a time when health care costs are soaring, it's obvious the emergency department is not the most cost-effective choice. But when it comes down to the bottom line, it's a business, and sick patients mean revenue. Now, for a link to the reservations page at St. Francis or the wait time pages at Methodist, you can log on to our website. That's myfoxmemphis.com. As far as Baptist Memorial Healthcare, well, they say they will continue to treat those patients as they have on a first-come, first-served basis. Of course, all urgent cases head to the front of the line. For now, reporting live in East Memphis, Lauren Johnson, Fox 13 News.
So who uses and abuses the emergency room? Well, the University of Memphis released a study recently, and in that study they found that of the 4 major metropolitan counties in Tennessee, people in Shelby County use the ER for non-urgent health care more than any other. Women are much more likely than men to go to the emergency room instead of a physician for non-emergencies, and it would then stand to reason that children under 5 years old are more likely than any other group to be treated for non-emergent problems in the ER. Now, here to help us better understand this issue is Christy Travis. She's the CEO of Memphis Business Group on Health. Christy, thanks for joining us tonight.
Thank you for having me.
Hey, now, emergency rooms streamlining their services, no more long lines. This all sounds great, but isn't this just kind of opening the door for more emergency room abuse?
Well, I certainly think it's going to make it easier to use the ER, and if you really need to go there because of an emergency or you're in some kind of urgent situation, I think that these streamlining efforts will be beneficial. However, we also know, as you just pointed out, that a lot of people are going to the ER who really need to be seeing a primary care physician. And so the fact that it'll be more convenient to go to an ER actually will continue to enable them to go there instead of find a physician for their care.
Doesn't this all boil down to big profits for hospitals? I mean, if you look at the copays, the copay for my physician is $20. I go to an ER, it's $250, $350.
Well, I'm not sure that it's just about the money for the hospitals. I do think that they're trying to serve the needs of our community. However, I know that it is probably profitable for a hospital to see someone who doesn't really need emergency care or urgent care. And therefore, by putting in some of these new services, they certainly are appealing to that population and therefore would be making more money in their emergency rooms.
Christy, let's do a little forward thinking now. What effect is all of the recent healthcare reform, the recent Healthcare Reform Act, what is this going to do to the situation? Are we going to see more people than ever before showing up with non-emergency illnesses at ERs?
Well, I think so, because a lot of the people who'll be coming into the system for the first time because they'll have insurance probably don't have a primary care physician. And so the logical place they'll go when they're sick is the hospital now that they have insurance. So I think it's even more important than ever that we really focus on how do we help people get a primary care physician and begin to use that physician instead of going to the hospital emergency room.
You know, healthcare providers have preached to us for so long, if it's not an emergency, go see a primary care doctor, go to a clinic, but don't clog up the emergency room. Right. This new appointment system, it seems a little counterproductive to that. So I guess the question begs, who's responsible for getting that message out now that ERs are opening the door to make an appointment?
Well, I think everybody's responsible, including the employer who's offering their health benefits to their employees. My personal story is that I used to use the emergency room as a primary care physician myself until my copay went up to $250. And that's very much more money than if I only had to pay $30.
That'll definitely change your mind. Well, Christy Travis from the Memphis Business Group on Health, we appreciate you helping to shed a little light on this subject tonight.
Thank you.
Thanks for joining us.